Good morning, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes, and this is Juju, my 10-month-old French Bulldog, who's learning how to be an excellent office dog. She's doing very well, aren't you, Juju? Yep. So today we're going to talk about neuropsychiatric illness in tick-borne illness, and this is very, very important. Um, Both Lyme and Bartonella, and to a certain extent Babesia, can cause pretty severe neuropsychiatric conditions like psychosis, schizophrenia, ADHD, OCD, Tourette's, depression, anxiety. And what we believe happens is that these organisms cross the blood-brain barrier, which is a very thin barrier between the brain and the rest of the body, and it's there to keep things out of the brain that shouldn't go in. And these organisms cross the blood-brain barrier, get into the brain, and cause severe neuroinflammation in various parts of the brain. For example, sometimes the hippocampus is affected, so your memory is affected. Or the limbic system is affected, so your mood is affected. Or the brain stem is affected, and your movement and coordination. Or your substantia nigra is affected, and you get Parkinson's disease. A lot of these infections go to the frontal lobe, and the frontal lobe is important for executive functioning. So problem solving, navigating life, the more higher level brain functions that are characteristic of being human. Although I would argue that in a lot of ways, Juju is much wiser than I, because she's driven by instinct, and she's pretty wise. Aren't you, Judge? So in any case, these infections can really wreak havoc in the brain due to neuroinflammation. And what happens is the brain is on fire. And when the brain is on fire, neurotransmitters are not produced properly. They're not fired. The neurons are not firing properly. The concentrations of neurotransmitters are all screwed up. And you really have to treat the infection in the brain in order to alleviate those symptoms. Now, in my opinion, there is usually an underlying genetic predisposition. So if you have, manic depression in your family, or schizophrenia, or psychosis, something like that, you're going to be at a higher risk for developing something like that as a result of getting tick-borne illness in the brain. Not everybody's infections go to the brain, and we still don't know why that is. As you know, there's a myriad of different ways that tick-borne illness can affect you, and one is in the brain. In older people, it looks like they get MS, Parkinson, ALS, things like that. In younger children, they get ADHD, OCD, things like that. And so there seems to be an age differential involved in this as well. And, essentially you have to treat these brain infections, with antibiotics, and probably you need psych meds, at least for a short while. I know when I was on IV, I had to be on benzodiazepines, which I hate. I didn't like that at all. But I was unraveling, and I had to get calmed down. So they put me on benzodiazepine for like 6 months, and it really did calm me down. So I think there's a place for psych meds. I don't think they're for everybody, but I think there's a place for them. And the treatment of neuropsychiatric Lyme and Bartonella, definitely you need antibiotics, and you need the antibiotics to cross the blood-brain barrier. It's really important to get that neuroinflammation under control. The other thing that I think is really important is glymphatics. So glymphatics is a process in the body whereby there is draining of the brain at night while you sleep. It's really critical to get that crap out of your brain circulation and eliminate it from the body. And then the other thing is to eat well. Of course, as a naturopath, that's the basic mantra of being a naturopath is you need to eat well and sleep well and drink plenty of water. And when you do that, you set yourself up for success. So I hope that this information has helped you. I hope you have a wonderful day. Take care. Bye-bye.